Hi everybody, welcome back. So continuing with our question and answers. So another question received by us, which many of our patients are asking us, is I have these nasolabial folds and I would like to do a filler for them. I have these nasolabial folds and I would like to do a filler for them. Yes, that is an option, but I personally have stopped or do the fillers for the nasolabials very rarely. Now there is a reason for it. As we age, there are different fat compartments in the face which have fat which gives the face the structure. It's called structural fat, and that gives the shape to the face, and that gives the support to the face, and that's why it's a structural fat, because like pillars on the building, so they are supporting the roof. So similarly here also there are fat compartments. So there are superficial fat compartments, there are deep fat compartments. So as we are aging, the fat compartments start to lose fat, and because of which you start noticing the hollows, you start noticing the lines and the wrinkles. Now what happens with the nasal in the fat compartments? There are a few fat compartments, most commonly the nasolabial fat compartment, the jowl fat compartment. These are some of the fat compartments where the fat actually increases to a certain extent as we age. So that makes these folds bulky, the jowls bulky. Now when we are trying to inject fillers into the fold, if this is the fold, we are injecting the filler to try and lift the fold and make it in at surface. But as we are aging, once this has become more bulky, if you're lifting it, you're adding more bulk in the area which is already bulky. Whereas a more better option would be to pull it back to how it should be. So if this is the nasolabial fold, if you can look in my cheek, you can see that because of aging the skin comes down and that pushes it medially, and also there is fat collection which causes this bulky fold here to cause the nasolabial. And the ideal would be to pull it back so that the fold is more effaced and try and put it back where it should be. So fillers for nasolabials I would do only in the very early stages where there is not too much of a sag or a fat loss, and yes, you just want something to be corrected. If you want in deeper grooves, if you want to be corrected, then the best is to do a thread lift, which is what I do, and not a simple thread lift. To do the suspended thread lifts which are fixed here, and that is what is going to pull it back, and it's also going to last you longer. A filler might last you about 6 months, whereas a thread lift, when done, the suspended thread lifts, will last you about 2 to 3 years. After that also, if you need, you can just add a few threads. And this is one of the reason why I don't do nasolabial filling anymore, except very early cases. Yes, it is still an option, but it is not something which corrects the problem. It just camouflages the problem. So to correct the problem, which is basically the sag and the volume loss, you need to pull it back, so that corrects the sag, and then you can add volume to the cheek, so that gives you a more fullness, and that also adds to the or enhances the effect. But I would not put the filler into the nasolabial groove per se. Early stages, yes, we can do it, but late stages I would rather do something which is going to correct the problem rather than just camouflage it. So no fillers for the nasolabials. Do a thread lift, or in Caucasian patients you might actually end up doing a facelift. So you correct the whole thing, you tighten the muscles and do a proper facelift, which will give you a more longer lasting result than just doing a filler which will just camouflage this fold. Thank you. We have many other videos regarding the same procedure. You can check us out, and if you have any other queries like this, just drop in a mail so we can always answer that for you.